Did you know that SIDS is the leading cause of death among infants aged 1 month to 1 year old? According to Washington Post, the rate of SIDS has decreased over the years, but it still claims the lives of about 2,300 infants each year in the United States. Many parents have experienced SIDS or know someone who has lost a child due to SIDS. It's good to be informed about SIDS and the many ways to lower the risk of it happening to your infant. I feel like I'm qualified to talk about SIDS because I have done a lot of research on the topic, and I've also had 2 family members who lost children due to SIDS. I'm going to inform you on the topic of sudden infant death syndrome, also known as SIDS. Some people may know about SIDS, but for those who do not know, it is good to be informed on what causes SIDS, what these symptoms are, and some preventive measures to lower the risk of SIDS. First, according to SIDS overview at WebMD.com, SIDS is when a baby who seems to be healthy dies during sleep. Most deaths occur to infants aged between 2 to 4 months old. In most cases, the parent or caregiver lays down the infant to go to sleep for a nap or for the night and comes back to find that the baby has died. It is really no one's fault because there are really no warning signs to SIDS. Now I'm going to talk about the known causes, symptoms, and diagnosis of SIDS. Most deaths are associated with sleep, and infants show no signs of suffering. Now I'm going to talk about the causes. WebMD.com states there are no known causes, but it's most common in premature babies. It is also most common in babies who have low birth rate. It's also seen in babies whose mother smokes during pregnancy and whose mother has no medical attention during their pregnancy. It's more likely in multiple births, meaning that giving birth to twins or triplets or something like that. It's also more common in babies whose mother is younger than 20. At WebMD.com, there states there are no symptoms or warning signs. It seems the baby is healthy when they are put to sleep and often found in the same position when the parent goes to check on the baby. They also show no signs of struggle. Last point, according to WebMD.com, states that SIDS is named the cause of death only when there are no other findings of a different cause of death. When the baby is examined, the parent's medical history and the place where the baby has died is examined, and an autopsy is also performed. Finally, I'm going to tell you about the ways to reduce the risk of SIDS. Based on my knowledge from my daughter's doctor, babies who are put to sleep on their stomach rather than babies who are put to sleep on their back are more likely to die from SIDS. Since Going Back to Sleep campaign, where pediatricians recommend parents now to put their babies to sleep on their back rather than the stomach, the rate of SIDS has gone down by 50%. According to SIDS overview at kidshealth.org, they say to place baby on a firm mattress with no surrounding pillows or blankets, and make sure the baby is not too warm when you go to put them down for a nap or to go to sleep for the night. Also, putting the crib or bassinet in the room where the parents sleep has also been linked to lower risk of SIDS. Also in the article on healthkids.org, it states, do not smoke, drink, or do drugs during pregnancy. Infants' mothers who smoked are 3 times more likely to die from SIDS than infants' mothers who do not smoke. Exposure to secondhand smoke also doubles the risk of SIDS in infants who are not exposed to secondhand smoke. In conclusion, growing public awareness of SIDS and precautions to prevent it should leave fewer parents and families searching for answers in the future. I hope you find this information helpful even if you do not have children. Everyone should be informed of SIDS as it can happen to anyone. I would like to end this speech with knowledge that researchers are studying the possibility that SIDS may be caused by problems with how well the brain controls the breathing. Thank you.